A very good evening to all of you. Welcome to you and I, the Eye Health Awareness Session, the first phase of the project Be Their Vision 6.0, a worthy initiative by the Leos of University of Colombo for the 6th consecutive time under the Vision category. This endeavor is projected to be carried out in 3 phases, where the next 2 successive phases are said to be held as an eye donation campaign, followed by an equipment donation to Sri Lanka's first ever vision therapy unit, which is expected to be established in the National Eye Hospital. Eyes being one's most valued organ in pursuing life, it is indeed required to protect them at any cost. Thus, to make this community more vigilant and conscious about eye health, UOC Leos have voluntarily stepped up to create a positive change. Let us now take a look at the introductory trailer of the project.
Okay, which one is better? 1 or 2? 1 or 2? 1 or 2?
With that, let me invite Leo Udeshika Ganegoda, the project chairperson, to deliver the welcome speech.
Thank you, Gihini. Good evening, everyone. As Gihini explained, our eyes play a vital role in our life journey. Therefore, it is my honor to welcome you all to the first phase of the project, Be Their Vision 6.0, which is organized by the Leo Club of University of Colombo for the Leostic year 2021-2022. First of all, I'd like to welcome our guest speaker, Professor Madhuwanthi Dissanayake, who is a consultant eye surgeon, professor in anatomy, Faculty of Medicine, University of Colombo. And also, I'd like to welcome officials who joined, representing Leo Multiple District 306 Sri Lanka, Leo District 306 C1, and other Leo clubs, including our own UOC Leos. So without any further ado, let's move on to the session. Thank you.
Thank you, Leo Udeshika. It is with great pleasure that I would now like to introduce the guest speaker, the reinforcing pillar of the today's event. She is a proud alumnus of the University of Colombo, who is well known for her excellent track record in academics and for her immense contribution in knowledge creation. MBBS, MD Ophthalmology, consultant eye surgeon, professor in anatomy, Department of Anatomy, Faculty of Medicine, University of Colombo, Professor M. Madhuwanthi Dissanayake. Ma'am, we are truly honored to have you with us on board today. අද දින පැවැත්වෙන මෙම වැඩසටහන අවසානයේදී ඔබට ඇති අක්ෂි සම්බන්ධ ගැටලු අප වෙත යොමු කිරීමේ හැකියාව තිබෙනවා. ඔබේ ප්‍රශ්න සිංහල භාෂාවෙන් හෝ ඉංග්‍රීසි භාෂාවෙන් අප වෙත ඉදිරිපත් කරන්න. This is a kind reminder to all the spectators. If you all have any session related concerns to get clarified by the professor, please feel free to direct them through the chat or simply unmute yourself and ask them during the Q&A, which will take place at the end of the awareness session. With that being said, Professor, please take over the session. The spotlight is yours.
Thank you very much. A very good evening to all of you. So at the outset, I would like to thank the organizers, especially Udeshika, for inviting me for this session. I believe that when talented young people like you all do something good, we should encourage and support you. So with that in mind, let's start today's session. So let me share the slides with you. And If you can't hear or if you can't see my slides, please let me know. So are the slides clear now?
Yes, ma'am.
Okay, right. Today's session, actually, I would like to tell you how we are going to do this session. We will have a small introduction regarding the eye, how the structure of the eye is, and then we'll have a look at the functional aspect of it, that is the vision. Then we will also discuss some of the common eye problems that are there in the community. Then we will move on to an interesting topic, which is the computer vision syndrome. And if you stay with us, I will also tell you a formula to avoid the computer vision syndrome when you are doing your day-to-day work with the computer. Then we will have the Q&A session. Okay. So getting on to the structure of the eye, even if you don't have a biology background, still I think from your school days, you may remember the eye as a very important sense organ. More than 80% of the information that is outside will be taken up by this small organ, and the information we take in is very important for an individual to function in daily life. So when you take the structure of this eye, as you know, there are three main coats or three main layers. You have the outer coat like this, which we say the frontmost part is the transparent cornea. Then that continues as a fibrous or a sheet of tissue which protects the eye. Then the middle coat, which is in red here, is the layer with the blood vessels, and also it has a lot of pigments. So that component, which is shown in red here, can be divided into three parts. Here you can see this one is the iris, and this part is the ciliary body, and the rest we call as the choroid. Don't worry too much about the nomenclature. Let's get on to the most important layer, that is the neurosensory or the nerve cell layer, which is the retina, which is inside. So what happens is when the light comes in like that through the transparent cornea, through the pupil, this is the pupil, the gap in the iris, the circular gap, and it will be going through the lens. This is the lens, and into the inside of the eye, and the image will be created on the retina there. So that is the basic concept you have to grasp to understand the eye diseases. So here another diagram to show you. So this part is the cornea, and behind the cornea you can see the iris, which we discussed earlier, part of the middle coat, and that has the pigments and blood vessels, and these pigments are the ones that give you the color in the eye. So some people have brown eyes, some people have black eyes, and some people have blue eyes. So the reason for this blue eye is they have less pigments, so that is why it is shown transparent or blue color. If you have pigments, it will be black. So what is outside the this part is the sclera, and if you can see the middle diagram here, that will show you a cross section of the eye. So as you earlier saw, this is the front part, the cornea, then you have the lens here, and as you can see, the small hole here is the pupil, and this is the structure that controls the amount of light that comes into the eye. So when the eye is more than enough light, this will constrict, and the hole will be very small. But when there is not enough light, this pupil will enlarge and let more light into the eye. So ultimately, this light will be refracted. That means it will be bent. So the light bending through the cornea and through the lens here will form an image on the retina. So this is the retina. The retina is also a transparent tissue which has blood vessels also running like this. So the impulses are generated in this layer, the retina, due to the stimulation of the receptor cells. Do you know the receptor cells that are there? Yes, the receptor cells, what you can see is actually given the names rods and cones. I'm sure you have heard about the rods and cones. That the name is because of the shape of the outer segment of the cell. So the rods have a rod-shaped outer segment and the cones have a cone-shaped outer segment. So these are the photoreceptors or the receptors for light. So these cells will get stimulated and they will generate electrical impulses. So here initially it is a chemical reaction, and this chemical reaction is transformed into an electrical impulse, and the electrical impulses are traveled through this optic nerve, and this optic nerve goes to the brain, and then we note that we are seeing things when the information is processed in the occipital cortex. Okay, so I hope you had an idea about the structure of the eye. If you have any questions, please you can disturb and tell me, otherwise we will get on. So when we consider the light that falls onto the eye, you may remember during your school days, you would have noted that the visible light we see is part of a spectrum. What is this spectrum? It is the spectrum of electromagnetic waves. So these electromagnetic waves are coming from different sources. So the main source is the sun. So when we get the light from the sun, there are different wavelengths. If you want to be reminded, I have put this diagram. So according to this wave theory, the light travels as waves. So when the light travels like this, the propagation is that way. So the light will be going like that. So we call it a wavelength, the distance between two peaks like this. And we have the amplitude of the wave from here, from a peak up to the line here. So this is the wavelength. So if you take the same concept here, you can see that the area or the electromagnetic waves that we can actually see from the eye, or the photoreceptors are stimulated, those electromagnetic waves are between, the wavelength is between 400 nanometers and 700 nanometers. So if you see, you can see the longer wavelengths, you can see are these, the red color, and the blue color has short wavelengths. So this has all the colors that you see in your life. We call it the rainbow colors. If you go to the other ends of this electromagnetic spectrum, you can see the other rays which have more energy. When the wavelength is shorter, the energy is higher. In this diagram, you can see in this table, So you have the blue light. You can see the wavelength is shorter, but the photon energy is more here. And the red color has the wavelength longer, but the photon energy is less. So that is why we say the ultraviolet light, which is just next to the blue light here, has more energy, as well as X-rays and gamma rays. That is why when these rays enter the human body, it can damage the tissues. Whereas you have the other side of the spectrum as infrared, and you have microwaves and radio waves, which are not harmful as the higher energy waves. So this is the spectrum, and the visible light is between 400 nanometers and 700 nanometers. So this light is the one that we also see when the white light goes through a prism. This light, the different rays are divided into different colors. But if you take all of them, it is the white light. So what happens when we see something red? That is, the object will be absorbing all the rest of the rays, but emanating only the red color light. So when that object is not absorbing red color, our photoreceptors can see or absorb that light, and then we say we are seeing a red object. So these are the colors that you see within the white light. So how do you see color vision? Again, if you take the retina, the innermost sensitive layer, this retina has the photoreceptors we earlier discussed, rods and cones. Out of these photoreceptors, the cones are the ones that are receptive to color vision. So these cones have to be stimulated by higher light energy, higher intensity of light, whereas the low intensity of light will be stimulating the rods. That is why when you see something in the dark times, you are unable to separate the colors. You can only see the object, but the colors are not visible. That is because the light is not enough to stimulate your cone cells. So these cone cells are there in the retina. There are three main cone cells which are sensitive to red light, green light, and blue light. So when you have the light coming from the front part of the eye and stimulating the red cones, you will be seeing red color objects by processing of the information in the brain. So this is the reason why you see color vision. What is color blindness? When some people are genetically born with absence of different types of cones, that is, if they are born with the absence of red and green cones, then they will not be able to perceive different colors such as red and green. So for example, this will be the normal vision, but if they are color blind or anomalous color perception in red and green zone, they will be seeing the same balloons as these. Whereas if the patient cannot see the different colors, it will be seeing like this. So the most common type of color vision defect is the red and green color defect, and that is generally genetically transmitted. So it is more commonly found in males. about 8% of color blindness is there in males, and 0.5% is there in females due to the genetic transmission. The pattern of transmission is what we call X-linked recessive. So those are details, but that is the commonest type of genetically or by birth. If you have color defect, color vision defect, it is like that. Apart from the genetic or the inherited color vision defect, some people can also have acquired or later on developed color vision defects. So that is due to optic nerve damage. So that is about the color vision. How do we check color vision? This is important because for certain professions, for example, pilots or people engaged in industry like textile and even electricians, those people will need to have their color vision in perfect condition. So before recruiting, the new recruits are checked for color vision. So there are different tests to check color vision. One example is this Ishihara chart, where you are asked to read these numbers. So that again, there is a different, so much of detail is there, but we are not going into detail there. So let's now take a look and see how we are able to look at different objects in different distances. Now, when you are taking a picture from a camera, what do? You focus the camera. Nowadays, of course, autofocus, but if you have a manual camera, you have to focus. That is, you have to change the distance of the lens with the camera film. Here in the human eye, we have a different mechanism. What happens to focus the light onto the retina in the human eye is by changing the curvature of the lens. So how do you change the curvature of the lens? So naturally, when the light comes from a distance, they come as parallel rays. And when they hit the cornea and the lens, they undergo bending or refraction. So this is the natural way or the relaxed state. But when you want to make this image from a nearby object, then the light rays will not be coming parallel, but they will be coming like this, dispersing from this object. So when it comes to the lens, you need to bring it together. So the power of the lens should be more. That means the lens should be more curved. So the curvature of the lens need to be increased. So how do you do it in the human eye? There is a special mechanism. The mechanism is there is a muscle. So we call it the ciliary muscle. So this ciliary muscle will be contracting when you want to look at near objects. So when you are looking at the computer now, you are trying to look at something close. So your ciliary muscle is contracting, and with the contraction of the ciliary muscle, the fibers that are here, we call it the suspensory ligaments, they relax. And when they relax, the curvature or the thickness of the lens will increase. And then with this increased power of this lens, the light rays will be able to bend more than earlier, and they will be able to focus on the retina. So this focusing on the retina is very important to get a clear image. So now sometimes there are problems which occur when these focusing mechanisms are not proper. Now, let's take a look at some of those problems. So this is the normal vision where you get the light rays coming. The bending is actually done not only from the lens, but also from the ear cornea interface. That is where the tear film is covering the cornea. So both these surfaces will be taking part in converging the light rays. So anyway, this is the normal vision, but there can be instances where the eyeball is too long. Then what happens? Then the light rays that can come will be not focusing on the retina, but they will be focusing in front of the retina. That is because the eyeball is too long. You may have seen some people have big eyes, so they cannot see distance because the objects they see will be focused in front of the retina. So what we want to do is we want to send these rays to a further distance. So what we do is we do something opposing the convergence. That is, we have here a lens which is this one. This is a concave lens. So this concave lens will make the rays go further to the distance. So this is the concave lens treating the short-sightedness. Similarly, we have another condition which is called hyperopia. This happens in individuals who have small eyes. When they have small eyes, the image that is formed will be forming behind the retina. That is because the eyeball is too small. So then what we want to do is to bring the light rays together soon. So what we do is we have a convex lens here. So this is hyperopia or hypermetropia, or they can see far better, right? So, but they will not be able to see near as much as they need. So what we do is we have a spectacle lens, which is a convex lens. Then there is another type of a refractive error. So we call these refractive errors or errors of focusing. So this type of error is astigmatism. So what happens here is their cornea or the front part of the eye is not regular. So they have different points of focusing on the retina. So what they see is not clear. They will be seeing the object but not clear. If you look at this diagram, you can see the normal person will have a clear vision of this image, but the person with astigmatism will be seeing it in not very well focused. So this, when this happens, we have to use cylindrical lenses in according to the power that is needed. So that's a cylindrical lens in the necessary plane. We use that to bring all these different foci into one. So these are some of the refractive errors. So this is important. So that means if you have any problem like this, unless these are corrected, you will not have a clear vision or clear focus on the retina, and the eye muscle, the ciliary muscle, will always try to do more, contract more and get a clear image. And this will lead to headache. So that is why some people, when they are not wearing glasses or not wearing proper glasses, they will be getting headaches. So the treatment is wear their proper spectacles. Okay. So now you have understood, I hope, the different types of refractive errors and their correction methods. So these have been the traditional corrective measures or corrective methods. But now we have modern correcting methods also. That is, we can have a lens not away from the eye like a spectacle, but we can have a contact lens which is lying right next to the cornea. The other method is we can reshape this cornea by using sophisticated laser. We call it LASIK surgery. So those are two other newer methods that we use to correct the refractive errors. Okay. Another important question which we have been asked earlier is about the blue light. So what do you think about the blue light? Is blue light important? Is it harmful? Yes, the blue light is, as you can see, is part of this electromagnetic spectrum. So the blue light, what we see here is, it belongs to actually both the visible light and the UV light here. So the UV light which we cannot see, this is the visible part. So this blue light, as you know, has high energy. So if you if you get a lot of these high energy light, that can be harming the eye. So what are the main structures that they can harm? This UV light can harm the lens. And if the lens is involved, if it is damaged, you can get cataract. And if you get this blue violet type of light, which is also harmful, you can get what is called age-related macular degeneration. That is degeneration of the retina or damage to the retina. But this blue turquoise light, or the light which is there in the visible spectrum, is important for us to make our days and nights, the day-night cycles. We have a system of inbuilt clock. So this biological clock or our inbuilt clock runs on this important part of light. That is the blue turquoise light, which is actually taken to the a gland called pineal gland in our brain, and that will signal now it is night or now it is day, depending on whether it receives light or not. So this is important to maintain the sleep-wake cycle. So the question is, some people are very fanatic about getting blue light cut glasses or blue cut glass for spectacles, but you have to understand that the computers and TVs and phones are a source of blue light, but the sunlight is the major source of blue light. As well as, even if you have glasses, if you use these light protected, blue light protected glasses too long, then it will not be very beneficial, because it can disturb your sleep-wake cycle also. So that has to be used with some kind of understanding. Okay, so remember, blue light is not always harmful. Right. Shall we get on to the common eye problems now a little bit? What do you think? Do you want to ask any questions from up to this point? Okay, then let's get on to the next part of our session, which is about the common eye problems. So these common eye problems may not be sometimes involving the younger generation, but it is important for you to know because your parents or your grandparents may be having these problems, and you need to educate them and get proper treatment for them if any of them have these diseases. So what is the cause of blindness, the commonest cause of blindness in the world? Yes, it is cataract. Okay. And what is the main cause of cataract? Do you know the main cause of cataract? Yes, the main cause of cataract is age, right? So this diagram shows you a patient. I have taken these pictures from the internet. So this one shows a patient with cataract in the right eye. So what you can see is the lens which is here is not clear. It is opaque. So this has got opaque. So that is the reason why the patient is unable to see, because the light rays will not be traveling past this lens which is now opaque. So what is the treatment for this cataract? Yes, there is no medical treatment for this. It's only surgical. That means the surgery is necessary to treat cataract. What we do is we take this lens, we break it into small pieces and take it out, and then insert a new lens, an artificial intraocular lens, into the eye. And the patient will be able to see as how what he was seeing earlier. So that is actually the most successful surgery in the medical field, cataract surgery, as well as it is the commonest surgery that is performed in the world. So that is cataract. So apart from old age, there are many other reasons for cataract, including trauma or injury to the eye, diabetes, and other eye diseases and systemic diseases. That means other body diseases. They also can cause cataract. Okay, right. Next, we move on to diabetic retinopathy. As you can see, this diagram will show you a normal retina and a diabetic retina. So what do you mean by diabetic retinopathy? You know, diabetes is now very common disease in our country as well as in the world. So diabetic patients, actually the problem is they have impact in their small blood vessels. So the eye is one organ that has small blood vessels. So the eye or the retina, what is here, has these small blood vessels, and they undergo change if the blood sugar is not controlled properly. So normal retina will be like this with normal blood vessels, but if the diabetic is not under control, the patient with duration of diabetes getting on, they will have leakage of blood vessels like this. So there will be red blood cells leaking and proteins leaking and lipids leaking, as well as there will be areas which do not have blood supply because of the clogging of these blood vessels. And this will cause some areas to have no oxygen. And this will lead to formation of new blood vessels, which are very friable. And that leads to breakage of these blood vessels and hemorrhage into the eye. So that is why suddenly the diabetic patients can have loss of vision due to rupture of a blood vessel inside the eye. So what is the treatment? First thing is diabetes has to be controlled. Then the second thing is patients have to be screened, or annually, that is every year, all the diabetic patients should be sent for checking in the back of the eye, that is this retina, for changes in whether there are any changes due to diabetes or diabetic retinopathy. So if they are there, if they are in this session, is in this condition, we can use laser treatment, we can give injections into the eye and try and reduce the complications. Otherwise, the patient will lose vision. They can go blind. So it is very important. If they are detected early, they have treatment, but if it is advanced, then the patients will not be able to get back their vision. So diabetic retinopathy is the commonest cause of blindness within the working age group. Working population, the commonest cause of blindness is diabetic maculopathy, or the macula, or this area getting affected by diabetic retinopathy. Okay, right. Then we will move on to another disease, which is also a very disease that is commonly known and feared, that is glaucoma. Okay, what do you mean by glaucoma is actually, glaucoma is the eye, as you know, here is an organ which is filled with fluid. Okay, so there is a fluid in the front part of the eye and another fluid in the back part of the eye. So this part we call the vitreous, and this part is the aqueous humor. So what happens in glaucoma is the fluid that is in the front part of the eye increases, and the pressure of this fluid in the front part of the eye increases. This can be due to many reasons. So this pressure in the front part of the eye can exert the same pressure towards the back of the eye. So the vitreous pressure also increases, and this pressure will cause pressure onto the optic nerve, and the optic nerve can get damaged due to this pressure. So this is called glaucoma. So what is glaucoma? It is actually the optic nerve disease associated usually with intraocular pressure rise. Okay, so it is not only the pressure rise in the eye, but the associated damage into the optic nerve. So how do we check this? We can check the pressure in the eye by examining the patient. And also we can do functional tests. We can do other tests and see whether the optic nerve is functioning properly. We can do what is called visual field. We can take computerized pictures of the retina and identify the thinning areas of thinning. So likewise, there are different tests, but the important thing is 50% of the people who have glaucoma do not know that they have glaucoma because they don't have any symptoms, similar to diabetic retinopathy. Now, diabetic retinopathy also, until the last stages, they will not know that they are having diabetic retinopathy. So that's why the screening is important. Similarly, glaucoma is also not a disease with symptoms in the early stage. So unless you check for glaucoma, you will not be able to detect that until the last stages. So the good news is glaucoma generally, it can occur in the in children and young age also, but generally it is more common in old age. So when the patients go to check for their vision problems when they are 40 years, we call it presbyopia. When they are 40 years, as you saw earlier, this lens, when the patients are after 40 years, this ciliary muscle gets weak. So when the ciliary muscle is weak, they are unable to change the shape of the lens. So then what happens? They are unable to look at close letters and read them. So that is why when they need the glasses, like in this situation, they need convex glasses after 40 years. We call it presbyopia or Hatalis anterior. So the best thing to do is when the patients, when somebody is unable to read after 40 years, when they go to get their spectacles, it is better to get their glaucoma test also done, so that if they are going in for glaucoma, then they can be diagnosed early. Especially people with family history of glaucoma need to be checked for their whether they are also affected. So especially the patients who have a family history of glaucoma, better for them to go and get their eyes checked for glaucoma risk. Okay, right. Now, another common problem that is there is conjunctivitis. So conjunctivitis is can occur in any age, and it is also widely known as sore eyes or pink eyes. That is due to the conjunctiva, which is a transparent layer on the surface of the white part of the eye getting inflamed. That can be due to viruses or bacteria or chemicals, or even any mechanical reason it can get inflamed. So this we call conjunctivitis. So it is the inflammation of the conjunctiva. So the important thing here, it may sometimes resolve on its own, but if it is not treated, it can get spread among all the people in an office. So if somebody is having red eye like this, better to go and get it checked, because if sometimes it can get complicated and it can involve the black part of the eye also, the cornea also, then it can have an effect on the vision. Otherwise, the conjunctivitis will not have any effect on the vision. So if the this is actually it's a symptom, the red eye. So the important thing to remember about conjunctivitis is it may be conjunctivitis, so you have to be careful not to give it to others. But if you have with this conjunctivitis, if you have pain in the eye, if the eyes are paining excessively, or if there is any vision problem, if the vision is less, or if you cannot look at light, if there is a light and if it is very difficult to look at light, we call it photophobia, then it is very important to go and get your eyes checked. If there is reduction of vision, if there is pain, if there is difficulty in looking at light. So if the red eye is associated with that, always immediately go and get it checked. Okay, so that brings us to the end of some common eye problems. So I think we can get some questions up to now. Shall we get some questions?
Ma'am, we are still in the course of getting questions, so you can maybe continue a bit.
Yes, if you want to ask any questions, you can ask them now, or even later at the Q&A session. Okay. Right, then we will continue and then ask questions at the Q&A session. Okay. Right, so now we are all in the new normal era, right? So students, workforce, everybody is in the new normal era where we work with the computer. Even now we are doing that. So are we happy? Yes, maybe not, but there is no other option. We'll have to continue like this. But what are the problems if we continue like that? some of you may have experienced these symptoms: headaches, neck pain, back pain, knee pain, or pain in the other parts of the body. So these are common things sometimes if you work longer with your computer. The eye signs associated can be red eye, then blurring of vision, necessity to make your eyes small, then tearing, then dizziness, and double vision. So those are some of the problems you may have. So do you think there is any relationship with the use of the computer? Yes, this has been studied and put together as a syndrome or collection of signs and symptoms. So this is known as computer vision syndrome. So anybody who works long hours with the computer can have these symptoms. So the symptoms would include eye pain, irritation, gritty feeling in eyes, blurred vision, difficulty in changing focus, that is difficulty in looking near and distance, tearing, photophobia, that is difficulty in looking at light, increased frequency of blinking. So it is sometimes you need to blink frequently. Sometimes even with that you may have double vision, headache, tight feeling around eyes. So not only the eye symptoms and signs, but the rest of the body symptoms and signs such as neck pain, shoulder pain, back pain, dizziness, even aggressiveness can occur in the workplace due to these signs and symptoms. So this is part of the computer vision syndrome. Why do we need to know about this? We need to be aware of these and we need to learn how to avoid this. So we need to first understand why these things happen. So let's talk about some of the things that can cause this computer vision syndrome. So we can identify few of the factors. So one is posture, that is how you're seated in front of your computer. Then you can also discuss about the computer related settings, okay, specific to the computer. Then another important thing is the eye muscle fatigue. Let's talk about it in a little while. Then also you need to know about dry eye. That is one of the main causes for the distress. And uncorrected refractive errors, what we discussed earlier, also plays a main role. So let's get on with the posture. Okay. So when you are seated in front of the computer, what are the things that you need to know? You have to see that you are seated comfortably in a chair which has a back support, and the chair has to be the legs should be able to touch the floor, and they should be flat on the floor, and the knees should be at 90 degrees angle, same as the back and the legs. And also the forearm should be bent at 90 degrees here, and the neck should be in level. The monitor should be at an arm's length away. Okay, so generally it's 2 feet for a laptop or a desktop and 1 foot for a phone, and at least more than 10 or 15 feet for a TV screen. So that is the recommended distance. Also, when you look at the monitor, it should not be looking, you should not be looking up. It should either be looking straight or a little lower is okay. But it should not have a back like that where it is difficult. And you should not be having too close, your eyes should not be too close to the screen. So this is the apparently the correct position. But in this diagram, I see something wrong here. Can you think what is wrong here? Most of the things are correct here, proper, except for one thing. Yeah, that is you need an armrest. The armrest is vital. Otherwise, you can have problems here. So you need an armrest here. So make sure that you have an armrest. Okay. So next we go to the computer specific settings. So you can have the special gadgets like anti-glare monitor, you can have it. Or you can have a screen, a special one. Or you can have your illumination reduced. And when you look at this diagram, you have to see that you should not be working in total darkness. You should have the brightness adjusted here, what belongs to the previous one actually, the background one. The light should be coming from the back of the person, okay, but it should not be having a glare like this. It should not be causing a glare onto the screen like this. So it has to be adjusted properly. The ambient lighting has to be adjusted properly. And the computer specific modifications, what you can do is the illumination as well as your font size. That also you can modify. Then when you are using the background, see that you are using a white background with dark letters or something like that with high contrast, dark on light or light on dark. But avoid low contrast background and color schemes, and also avoid busy backgrounds because they will make your eyes get tired soon. Okay, so those are some of the specific modifications that you can do. Then eye muscle fatigue. Now you know when you want to look at something close, you will have to you will have to contract your ciliary muscles here. Okay, if it is distant thing, then you are not using much of your ciliary muscle. So that the rays are just making an image here. But if it is something close, your ciliary muscles have to work harder. So when your ciliary muscles are working hard, it cannot work hard for a long time. So that is why it is important to know that the eye muscles can get fatigued. This is one type of fatigue because of the ciliary muscle. Not only the eye intraocular muscles, but also there is another muscle that is working. That muscle is actually will keep the eye open. So this is the eyelid. There is a muscle that keeps the eyelid open. We call it levator palpebrae superioris, or the upper eyelid elevator. So that muscle will be working throughout when you want to look at something to keep the eye open. So the closure of the lid is by this circular muscle. Okay. So when you keep your eyes open all the time, your muscles, these muscles also get fatigued. So you need to think of that. You also have to see that this is the ciliary muscle. So these will be working too hard. If you have to contract if you contract these muscles, then if you continue it for a longer time, you need to give them a break. Okay, so intraocular muscles and extraocular muscles both. So remember not to make them too tired. So how do we avoid this? What we can do is taking breaks. So there is an important or easy to remember thing to do, that is 20-20-20 rule. What is this 20-20-20 rule? That is you can every 20 minutes, okay, so you start work at one point and then at the end of 20 minutes you take a break. What do? you have been looking at your computer close vision for a long time. So you take a break and look at a distance 20 meters away. So, or 20 feet away, you have to look away from a window which is open, or somewhere you have to look up above the computer and look away. So that is 20 feet away. 20 minutes, 20 feet away. And for 20 seconds, you have to blink. Okay, so 20 seconds, you have to keep your eyes closed and blink. So this blinking is important to give a break for your extraocular muscles. And also there is another effect I will show you. So remember this 20-20-20. So this rule will remind you to take breaks. So this is during the break, you will have to do like this. It's the frequent blinking and also complete blinking. If you don't do complete blinking, the whole of the cornea will not get wetted. So let's see who makes the cornea wet. We have 3 types of components on our eye, surface of the eye. One is from the tear glands. Okay, one component is from the tear glands. So that is the main tears. So this is the main tear gland. Tear ductules are there. From these will come and onto this one. When you blink, you will get the tears spread over your cornea. So unless you blink, you will not have a proper tear film covering of your cornea. That is why sometimes when the vision is blurred, when you take completely blink and see, then your vision is clear. That is because the debris and everything and the dryness is gone when you blink. Okay. So the second component is from the conjunctiva, from the goblet glands we say. So the goblet cells, they are on the conjunctiva here. So they will also give a component. There is another component which we will see. So the other important thing is when you blink like this, the used tears which are there is siphoned out of the eye into the nose. So this siphoning mechanism is also important. So the blinking like this is important for you to get your vision clear. Okay, so remember frequent, complete blinking. So this is the lid actually. So this is the cornea, this is the lens, and this is the upper lid. So in this lid, if you take a cross section, you can see this area. So there is another tear gland which is here. This is actually a sebaceous gland which secretes a thing, an oily secretion. We call it Meibomian secretions. Okay. So these secretions act like oil. So the main tear glands will give you water-like tears, but this water layer can get evaporated faster. So there should be an oily layer which is over that to prevent this evaporation. So this evaporation prevention is by this oily layer. So these glands are on the lid margins here. They bring their secretions from the tear glands, these Meibomian glands at this level. So have you seen styes in some people's eyes, eyelids? So that is when these glands are blocked, you can get a mass like that, a rounded appearance here. That is a stye. So that is due to a blocked Meibomian gland. So for the proper functioning of the tear film, you need to have this proper functioning of this Meibomian glands. So when you close your eyes like that, they also get themselves expressed. And that is very important for the tear film there. So this is a picture where you see the dry eye, and you can see these dry areas. So some people think tearing is not a symptom of dry eye, but it is. There is something called reflex tearing. So when some parts of the eye are not wet, they cause reflex tearing or the eye stimulation for tearing. Okay, so tearing can be in dry eye also. And if your doctor has prescribed, you have to use tear supplements like this to lubricate, because some people have problems with tears. But especially younger generation, you have to eat a lot of green vegetables and fruits so that your vitamin A and C supplementation is there, and that will help you to make these tears, keep the eyes wet. Okay, so that's food and nutrition. Okay. So this is another important thing. I told you about these Meibomian glands. So these Meibomian glands can get inflamed. So this is how the Meibomian glands get inflamed. So the styes occur like this when there is rounded areas, but when there is diffuse inflammation, you get like this. This is called Blepharitis. So this is also some a common problem where people have dry eye, irritation, and itching of the eye. This is actually dandruff or falling of cells. So what you can do is take 1 cup of warm water, put 6 drops of baby shampoo, and take a cotton bud, dip that in, and then clean this lid margin like that, okay, with the cotton bud. So when you clean like that, the Meibomian gland openings will be clear and the secretions can come, and there will not be inflammation after that. So that is important to clean the lids with this cotton bud, but not inside. Don't damage the cornea. You have to do it while keeping your eye closed. Okay, so that is Blepharitis treatment. This is called Blepharitis. Right. Now, are we okay with the time? Can we go on? How much time do we have? A few more slides only.
Please continue, Professor.
Yeah, okay. Can you hear me?
Yes.
Okay, right. Yes, okay. Right. So, is it important to check your eyes? Yes, even if you have no symptoms, it is important to check your eyes, because by checking the eyes, we can actually detect problems and they can be treated, and then your day-to-day life will be easier. Okay, so it's important, even children and young adults, everybody should have their eyes checked annually to detect any diseases what we discussed earlier, or refractive errors, or any other. Okay, right. So the refractive errors, we have the spectacles, right? So after checking, we check the spectacles and then we treat. Now this is presbyopia, or after 40 years, when they can't read the small letters, we give them. So this is the ciliary muscle not functioning properly, so the near vision is not properly seen. So we give them the convex lenses, and they can be they can read near vision without a problem. So here in the spectacles, one important thing is, when you are using the computer, there is a different kind of spectacles. One is actually for older people after 40 years, they can have what is called bifocal. That is, for distance and near both, they will have in the same spectacle lens 2 segments. But when you are using the computer, it is better to have what is called not a bifocal but a varifocal. A varifocal lens will have no separate margin. It diffuses slowly into the distance and the near segments. There is no definite margin, because with the computer, when you move your head, you have to, you should not have an image jump. You should have it going smoothly. Otherwise, if the usually the lower part of the spectacle will have the near vision, then the patients will be, people will be reading like this. So they will have problems with their neck as well as their eyes. So nowadays, the newer spectacles will have the varifocal, which is made for computer use. Then the other thing for the computer is they have the anti-reflective coating. Okay, so that means additional reflections from the computer can be reduced by this anti-reflective coating. And also the blue cut glasses are also important if you use it carefully. Okay, so other important thing is headache is a common symptom that many people may have. So headaches, if they are associated with these symptoms, you have to be very careful. If there is fever with headache, if there is neck pain with headache, then it can be an infection in the central nervous system. If you have nausea and vomiting, again you have to be very careful. Then drooping of eyelids, sudden drooping of eyelids, or difficulty in opening the eye, that is also important. And double vision, that may be presenting the symptom of a cranial nerve palsy. So the nerve palsies can present like double vision. Then pupillary changes, if the shape of the pupil changes, that's also important. Then sudden onset speech difficulty, weakness of one side of the body, unsteadiness, that can be the presenting symptom of a stroke. So with the headache, that may come. Also, if there is any history of animal bite, head injury, or any other injury, and with headache, you have to be very careful. And also during pregnancy, headaches are very important to be sorted out what is the cause of it. So some systemic diseases like high blood pressure, even eye diseases like glaucoma, or even brain tumors can be presenting as just plain and simple headache. So you have to be careful and seek medical advice if you are having prolonged headache or recently worsening headache. You may have had a headache for a long period, but if you are having a change in the headache, or if there is any vomiting or nausea with the headache, then better to get yourself checked. Okay, so this is what I have promised you. So we are coming to the end of our presentation. So this formulation is specially made for this presentation for you to remember. So to avoid computer vision syndrome, you can remember this. Be smart. Okay. So always when you start your work with the computer, because you may be using your computer for a longer duration, maybe you have to listen to lectures, maybe you have to make a presentation, maybe you have to write an article. So you will be with the computer for a long period. So be smart. What do you mean by be smart? B is for background. So get your table cleared. See that you have enough space to keep your hands, keep your mouse, everything, and see that the background lighting is there. See that the seat is comfortable. Your chair has a good backrest, and the height of the chair is okay. So all what we discussed, background and ergonomics. E is for ergonomics. Okay, all the workplace changes, that is the height of the chair, all that we discussed. So the computer changes, all that should be in ergonomics. So the background, the lighting, and the place for your computer, ergonomics about the chair that you take to sit. Then S will be spectacles. If you are prescribed spectacles, use them. If you are prescribed tear supplements, use them. Okay. Then M is for modifications. So that is your illumination. Because we actually did a study among the medical students, and they are using the illumination, changing of illumination, mainly as one of their main modes of reducing the symptoms. So taking frequent breaks and modifications of the computer are also very important. So M is for modifications of the computer. So illumination, font size, background, all that, right? Then another important thing is adequate hydration. Keep a bottle of water with you. So at every break, take a bit of this water because hydration is important, right? And take regular breaks. That is the breaks for the intraocular muscles, that is looking close and distance. So take the 20-20-20 rule and also close your eyes and give the muscles a break, as well as get up and go around and give your other skeletal muscles also a small break. Then time is the screen time. So that is also very important. The screen time more than 10 hours is detrimental. Okay, so the children should not be given, the screen times have been recommended by the college of the pediatricians of USA have given guidelines for children, but for adults, more than 10 hours is not very good. So if you are working, then your recreation should be something else, something physical, not using the computer like video games or maybe watching a movie. So remember that. So by being smart, be smart and avoid computer vision syndrome. So that is something special for you for this presentation. So remember your nutrients, fresh vegetables and fruits, as well as hydration and physical activity. So I think with that we can conclude the session. If you want any questions to be answered, we'll have the Q&A session now. Thank you for listening.
Thank you, Professor, for that insightful session that we had. So far, all the questions that we have received through our Google form has been answered. So if you all have any more questions to be asked, this would be the time for you to ask. You can simply unmute yourself or put questions in the chat box so that we'll direct that question to the professor to answer. We have received one question. It's regarding the sleep schedule and the eyesight. So this is a question that I would also personally would like to ask. As students, like, it's inevitable for us to stay up until very late at night. So is there an effect on our eyesight and our sleeping schedule?
Sorry, can you repeat the question, please?
The impact that our sleeping schedule has on our eyesight.
Yes, actually, it's a very important question. The sleeping schedule has important implications on your daily hormonal cycle. Actually, the eyesight is mainly the eyes will take up the light to detect the day and night changes, and that will be sent to the pineal gland, and through the pineal gland there is melatonin, a hormone that is secreted. So this melatonin increases with darkness, but if you keep up till late, then melatonin secretion will be less. So this melatonin is important to keep your not only the vision but all the activities of the body in correct coordination. Okay, so sometimes the not only vision but all the hormones can have problems, and some people can have depression, some people can have headaches, and different problems can occur if the proper sleep cycle is not there. So it's very important to have the sleep cycle at least between say 10 o'clock, 10 p.m. and 4 a.m. That sleep cycle is very important. If I can tell you a story actually, that is now when we treat patients, now you know the 6-6 vision is the last line that they should be able to read. But do you know that for people,
elaborative answer. So we have also received another question asking about blue cut glasses. So they have asked what is the quality that we should be aware of when we are selecting a blue cut glasses. Yes.
Yes, actually, there are different companies that they make blue cut glasses. So I cannot actually tell you which one is particularly good, but there are machines also that will check which one is good. Now, even sunglasses, the optometrists, when they dispense their glasses, they will have machines to check how much of UV light is cut. So like that, they have machines. So if you get it from a reputed company or reputed optometrist, then you are safe actually. But if you go and buy it from off the payment, then there is nobody to take the responsibility. So the manufacturer will give specific instructions on the glasses. That's why some of the glasses, spectacles are expensive. But then it is very important to have the correct UV cut or Blu-ray cut of the blue cut glasses, because now, for example, suppose you are wearing sunglasses which only have a dark color, but which does not prevent the UV light coming. What happens? Your iris will dilate because the visible light is less, but then you are letting in harmful levels of UV light because there is no filter. So that way it is more harmful to have a sunglasses or blue cut glasses than not having one at all. So therefore it is very important to have the proper glasses with their manufacturer's details all given in the glasses. So that is very important to choose. Hope that gives adequate information, but you can actually go to different different dispensers and get their information and see. You can go and check how they give, because some of the dispensers, the optical dispensers will have machines to check. They will show you how much is whether it's 90% cut or how much is filtered. They will show you. Okay.
Thank you, Professor. So we have received one last question, which says, after undergoing the laser eye surgery, are there any side effects that may arise after 2-3 years?
Yeah, actually, laser surgery, the LASIK surgery is the surgery that will reshape the cornea. So if the light rays, bending of the light ray is not enough, then we can, with the computer, we can do this surgery, laser surgery. It's done in Sri Lanka also. Little bit expensive, but it's done, and most of the people are happy. But there are some, there is a subgroup of patients actually who are not happy because of side effects. So the main side effects you can say would be dry eye, because some of the nerves are also cut when the surgery is done. But those are very tiny nerves. You don't have to worry too much. But some of those, like less than maybe 5%, have this problem of dry eye. So they are really very much in distress. But most of the people, the majority, are very happy because they are now able to do their day-to-day work without glasses. So the problem is you don't know which group you would belong to if you go and get that surgery done. On the other hand, later on, the late complications, sometimes there can be undercorrection or overcorrection, and you may need to wear glasses also again times. And then when the aging occurs in the eye, there can be other diseases which is common to anybody, which can occur in the eye, such as cataract or diabetic problems. All those can occur. But LASIK surgery per se, the main problem is dry eye. Main complication would be dry eye.
Thank you for that answer, Professor. So with that, I believe we have come to the end of the Q&A session. As we have reached to the end of the Q&A, we are going to make a FB link of the live recorded session available in the chat box, and it will be highly appreciated if you all can share the link of the live recorded session and like the official UOC Leo page. So finally, I would like to call upon Yogana Havergate, the secretary of the project Be Their Vision 6.0, to deliver the word of thanks.
Thank you, Ginny. Good evening, everyone. As the first phase of Be Their Vision project, we wanted to give awareness on many important aspects of visionary. I'm sure all of you have gained a lot out of this insightful session, so it's fair to say that session was a great success. First of all, I would like to thank Professor Madhuwanthi Dissanayake for sparing a valuable time on behalf of us and sharing more knowledge on this important and timely topic. And I believe what you said had a significant impact on many of us. Also, I would like to express our sincere thanks, and we are so pleased to have all the members who are here representing Leo Multiple District 306 Sri Lanka, and for all the other Leo District 306, C1, and other Leo clubs, including our own UOC Leos. Last but not least, many people have contributed in many ways to turn this event into a smoothly running session. So I extend my thanks to the committee as well as the other Leo members who helped to make this a success. Finally, thank you all the other participants for joining today.
Once again, I would like to thank our professor for joining us amidst her busy schedule. So with that, we have come to the conclusion of today's event. So with that, we wrap up today's event. Thank you for joining us. Good night and stay safe.